Already you got the slide before I asked you.
True,
Thank you.
true. It is very important because it gives you the idea to it will at least it will reduce the failure access of the ureter for this stone. For example, if you have the imagined 6 millimeter stone in the upper ureter and you say, okay, I'll put a stent. No, you take a 7.5 and you go to the stone and you destroy it and you put a stent until your patient come and remove your stent. And instead of putting the stent and you said, okay, come again, I will remove the stent, but this sort of impaction and blah, blah, blah. So it saves the surgeon, it saves the patient as well.
Dr. Saeed, I recommend for everybody here, audience, to follow. I think 100% from the audience follow Dr. Saeed on the LinkedIn and Facebook and Twitter also. But he has a lot of real picture from the practice that show the uh, bad side or dark side of RIRS complication. Did you think that there is any difference between the complication that arise from small scope and bigger scope? I mean, can we blame the bigger scope, the 9 French scope,
That's a good point. That's an excellent point. I see that the size, yes, it does matter. The size, even for the PCNL, once you go bigger, you have more bleeding. So for the once you go for a scope 9 French, it's not like 7 French. But again, I say that these are tools. We cannot blame tools. We blame the guy who's driving the tools. If you are driving 7.5, you could do injuries more than a wise surgeon who driving 9 French. So it's not only about the size of the tool, ya Majid. It's about how do you deploy these tools inside the practice. Now, the size come to you not to reduce your complication. It came to you to help you to reduce the failure of access, to improve your outcome. But you have to know when you stop. And the idea here that if you have even a 7.5, it does not allow you to go inside the ureter. Please stent the ureter. It doesn't mean no, I have to go. Saeed, he said 7.5 goes inside any ureter. No, please. It depends on the subjective force that you apply as a surgeon. Some surgeons, they don't realize how much pressure being applied on them by the family or the patient himself. So he said, I will get rid of the stone because the patient expecting from me much better results. And this is wrong. You should listen carefully to what is exactly facing you. If something happened and is not allowing you, do not waste time. Drain and run. Put a stent and come back. No, but they will blame you if you create a problems. And this is the idea.
Thank you, Dr. Saeed. Okay.
Now we go in, Majid, other than the impacted stone, we come to the specific situation, the pediatric stone. I have done like hundreds of children with a stone. I was doing 8.4 Olympus. Now with the 7.5, it was amazing how we could use them inside these kids, like 3 years old girl with a 1.6 stone was stented in another hospital. Look how beautiful. We use a 7.5 with an access sheet 9 French. There is an access sheet 9 French in the market. You will have a 1.5 French between the two, between the space, but it will help you. Look at this. How do you prepare the case? First of all, we do the table. As you listen to the video, you will see. About 1.6 centimeters, they have a stone. The patient was presented 3 weeks ago. The first step is the table preparation. We prepare our table. We sketch it below the lip of 4 years old with a special control. We divide our table to which area? The empty area, dry area. We need some dry clothes in the water area. We remove the skin using our 8 French. And we have a special irrigation. We call it T-flow for the management of the fluid during the operation. Second stage of this kind of operation is to prepare the guide well. We prefer in the region of intervenient surgeries is hydrophilic guide well. Hydrophilic guide well, this is one of the finest. There is no hydrophilic. You have straight and step. Straight is 3 roots. The step the stand for about 50 centimeters away. We can find it from different companies, 150 centimeters. So this is the long distance from first pass, 50 centimeters, and it's a 4.8. If it's okay, you say this one will go. This is a 3.5 8 millimeter, which is 0.35 inch. It fixed every double distance above 4.8. You can see here, we will insert, we will use, because these kind of wires lives in the water. You can see, cannot flush. See my get where is there. Do not push it. You just simply get wire away. As you can see, very small, 4.816 centimeters. Next, our irrigation system, the fluid management system, so you just, it will have a flow according to the gravity. Put 40 centimeter, 15 centimeter, and then we have the manual pump just to receive a little bit of the versatile irrigation. Then we take the scope. We are using the Innovex 7.5, very fine scope. The angulation is 200, almost 75. It's the minimum that you need. The maximum that we need is 180, but this one, as you can see here, the deflection of up deflection and down deflection as well, it might reach to 185. The size is 7.5, the shaft, and the manipulation is ergonomic, and you have a walk angle. You can see here, you can walk it and stay in the same position. Now, and I explained to you a while ago how do you prepare our table and then put the access sheet. And this is exactly a 3 years old with a 1.6 inside the kidney. And eventually by the dusting laser, look, these are new innovations. You cannot ignore them in treating certain category of patients with who are the child, especially children below 6 years old. Below 6 years old are always challenging. I always, as in the publication said, you have more complication and less stone free, and you have to. And I think you need to present those kids below 5 or 6 years old. And this is the girl, 1.6 with the 7.5 completely stone free. And we solve the problem with these kind of patients. Very unique, very delicate ureters, small ureters in the kids. Now, the second case, Majed, is a big stone, 2.4 centimeter. Yeah, he was presented 3 weeks ago. Due to a stone in the upper tract, the renal stone about 2.3 centimeters. We prepare our table here, and you can see the patients on the table. The table here is divided by 4 parts. The dry part with the dose, the wet part, likely to be in this corner. And here is the dirty part, and you have a free working. Second stage, we prepare our material. One of the two main parts of the preparing of the guide well, we use the hydrophilic guide well, tip guide well, one of the best hydrophilic guide well, and floppy tip about 6 centimeters. The second part is the irrigation system that we use. It's gravity-based irrigation with a manual pump, and the manual pump gives you some of the versatile irrigation to increase and improve the diligence without compromising the high pressure over the upper tract. We use an access sheet with section, as you can see here. Unfortunately, we don't have the 2025 for the baby 6 years old and below to the 20 centimeters. Here we have one option which is 40 centimeters. We have to walk away. So we need a section to avoid any increase in the renal pressure. And this system contains a very fine 10 French, very small hydrophilic, and the part here, as you can see here, to control the pressure. The guide where you see is in the kidney without no doubt. We empty the bladder